Hey guys, thanks for joining us here on the Brooks Report Live. My name is Adam Brooks. Listen, we have some exciting new series coming up for you called DocTalk with Reagan. Reagan, thank you for joining me.
Hey Adam, thanks for having me. We're so excited about this new series we're going to be starting.
And listen, I just wanted everybody, I'm not going to be a part of this every week. I just wanted to hop on here and explain to our viewers what's happening here. They have an opportunity and a rare opportunity to get on here and have one-on-one time with a real doctor, not a fake doctor, not just a TV doctor, but a real doctor that practices, medical practice every day and goes in and sees patients, and they have an opportunity to get on here, ask questions. You're going to try to get to every single one of them. But if you don't, there's good news ahead, because I think you guys are going to do it more than one time.
That's right, Adam. We're going to be doing it every Wednesday. It's our new Live with Reagan series, Doc Talk, every Wednesday. The times may change, but it's going to be the same day. We'll let you guys know. If you just follow the Facebook page, we'll add events so you guys can, stay tuned into all the latest topics that you guys want to hear about.
That's right. Don't forget about that little bell. Set your notifications to all and never miss an episode of Doc Talk with Reagan. You know what? I'm going to bow out now. Reagan, you can take it from here. Good luck, guys. Don't forget to engage and ask your questions.
Thanks, Adam. Take care, buddy. What's going on, Dr. Goffi? What's up, Facebook? How is everybody doing today?
Good afternoon. Glad to hear to join for our first time. Excited.
Awesome. Yeah, we had a power outage here, guys. I'm so sorry we lost you for a few seconds, but I hope you guys are able to join back in and come join us for our Doc Talk today. We have our brand new episode, and today, our first episode, we're going to have Dr. Goffi. Doc, if you want to say hi to everybody, go ahead.
Hi, everyone. Happy to be serving everybody in Lumberton and having these chats to get some good information out there so we're all healthier leading through the summer and leading into the winter.
Awesome. Well, guys, our first topic today, like we said, we're going to be doing this every Wednesday, but our first topic today is dehydration. So to start you off, Doc, let everybody know, what is dehydration?
Sure. One of the major things that we're seeing is, all these complaints that are coming into the emergency room from, headaches and fatigue and muscle cramps, even constipation. You're seeing them. And unfortunately, most of those are based off the starting point of being dehydrated. Most of us don't understand that we just go out to go get our mail and you're soaking wet and you just lost about a liter of fluids just going to go check your mail. And, it's very blistering hot outside. And in our area, we tend to do a lot of stuff outside. We mow our own yards. We walk outside. We do things. Most of the patients that come in, and, they're all pretty handy and good conversations that they're building this or building that. And that's when these complaints, kind of happen because it's so hot outside. It's one of the unfortunate things that people just don't like drinking water. And we need to try to fix that and just kind of pay attention to getting a minimum consumption per day and alleviate a lot of these symptoms that people are coming in for. And, which we're happy to see you for that. But naturally, if we can get you a little bit healthier, more hydrated, it'd lead to kind of a better day and a better week.
Perfect. So a lot of people ask me, what is the biggest cause of dehydration? What is the biggest factor you think that plays in this?
So, in the winter, we do a little bit better of conserving the water, right? But if you notice your day in the winter, right? I know I especially notice it like at work. If you're drinking these little water bottles, right, during the winter, throughout the day, you'll have 3 or 4 of them, each at different consumption levels that you forgot which one's yours, or, but it's cold outside, so we're not sweating as much. We're not, exerting as much, right? Now in the summer, you're not going to see those bottles because you're going to grab it and it's going to go down. But over the course of time in the summer, that sweating, if you don't drink enough water, it's just every day you're less and less and less neutral on how much your body needs, right? And, we try to say, oh, I got my 8 cups in. It's impossible to remember how many cups you drink. Or even bottles, unless you're lining them up every day and throwing them out. It's very complicated. That's why I have my good old Bucky's cup, right? And my wife has this. My wife actually has this big gallon jug, And it's kind of cool because it has, the times of the day, by 8 a.m., 10 a.m., and even some motivational things there. It's, if it's 10 a.m. and you don't have it, it says, just keep chugging. She got it on Amazon for about $15-20. Maybe I'll send you guys that link and we can send it after, Reagan.
Perfect. Yeah, for sure.
It's pretty colors, purple and pink and things like that. And it's been a big hit also in general with, some of her patients. She's a nurse practitioner at a clinic at a wellness center. So a lot of the patients have bought it and found that it makes it easy because you know exactly what you're getting that day and how much you are behind. And through that process, you'll realize how many days you're going to be behind and you have to get better at it. And that's kind of what leads us to heading to the emergency room. You start to get a real picture of, wow, I can't believe I thought I was drinking all day. I only got, 1 liter in.
Right. Well, that brings me into this question. Jason said, I was on the golf course Monday, 95 degrees plus weather, no wind, little lightheadedness, and started seeing black spots with my field of vision. He headed off with lots of water. He's curious, was that the start of it? Was that a warning sign?
Absolutely. So remember, water is also the how our body maintains blood pressure, right? And that's why you get all these incredibly complicated symptoms associated with the base of it being water. But if you need 10 liters of water in your body, let's say, just to give it a number, and you're sweating, right? Well, that volume also is part of the blood pressure. You have this vessel that normally is 1 inch in diameter, now needs to constrict because you don't have enough volume, and therefore your blood pressure shoots up. And with high blood pressure comes blurry vision, can come chest pain, can come headaches, can come a variety of things. And you can get black spots. It just depends on how old you are, whether your body can compensate it. Naturally, a 12-year-old probably, their complaint will be more of constipation. But us not so young anymore individuals, we feel it in different ways. We feel it with headache. We feel it with a variety, blurry vision, fatigue, muscle cramps, right? Last time I've never heard a 10-year-old complain of muscle cramps, but but we sure do after a long day, especially after golf.
Right, for sure. So I hope that answers your question, Jason. Kristen asked a question. She said, so, hey, Doc, we have a lot of athletes in the Baytown area who are about to get back into the sports. What can the athletes and their coaches do to make sure they are staying properly hydrated? What should they be drinking? Is there any special secret?
There is a special secret that we have to be really careful with kids, okay? Kids will then start saying, oh, no, I need Gatorade, or any of those million other sports drinks out there. There's nothing better for the body than water, okay? Nothing. And I think the best way to avoid it is, we got to send our kids, with these water containers. We have to be proactive. That way you can monitor. You can't send your kid with a little spray bottle of water because that's probably all they're going to get. So the big, like I said, that one thing that my wife uses, which is about a gallon, it's easy to carry. It's easy to drink out of. And it, especially with kids, you can even compete about it. Hey, I got all my water in, right? And you can have that. And I think that's overly important, okay? Because these kids are out in the field. They're not going to be able to refill the water easily. Unfortunately, it's just kind of the issue with a lot of the sports. Mm-hmm. So the more they bring with them, the better it is for us. And kids, not only that, they're going to play better. I mean, if they're hydrated, they're not going to complain to us or ever say that they need water. So it's up to us to kind of help that.
Exactly. So another question I saw somebody asked, how much water should they consume each day? What is a good goal for somebody to set?
Well, so most people, a gallon a day is the best. Okay. But if you get 2 to 3 liters in, that's good. Now, all right, there's going to be some side effects. The more you drink, the more you pee, right? I get it. I totally understand. Nobody wants to be up all night. So naturally, the body does an excellent job of knowing when to use water, when to conserve water, and when to hold on to it, okay? Mm-hmm. I recommend trying to get as much humanly possible water in before 6 p.m. That way you don't have to pee at night as much, okay? But of course, if you're doing sports late into the evening, you're going to have to drink some water, right? But I think if we can get 2 to 3 liters in minimum, gallon would be ideal, especially in the summer. And you try to get it all in before 6 p.m. That way we're not up all night. You know, I know that that's an issue for some people, of course. As you get older, right, you know, once you cross the 60, 70, you're not as active. You can kind of hover around the 2-liter mark and be very comfortable, right?
Right.
But even in the elderly, if you have comorbidities like diabetes or, you know, blood pressure, you know, the more water you drink, the better it is for you, the better it is for the body. So it's not all just because you're older, you drink less, right? I mean, those medications have side effects. So the more you're hydrated, the better your body works to use them effectively.
Okay. So I have another question here. Is pickle water versus Gatorade? Which one's better? Pickle water versus Gatorade for when you have cramping and you're dehydrated?
Pickle water.
Never heard of that. Hey, I've never heard of that one, Doc.
I never actually heard of that. But you know, when Gatorade was first designed, a lot of people don't understand this. It wasn't designed to be drank, you know, as your only consumption of fluids, right? And the reason for Gatorade, the changes that you're seeing now, if you notice when we were, you know, 10 years ago, when you drank a Gatorade, it tasted different, right? Even though they say it's a normal Gatorade. So it's watered down because of the complaints and the issues that people were having of drinking the Gatorade, thinking it was for hydration. And when you drink too much Gatorade, you can actually develop cramps because it increases the salt, it increases potassium. It's got a variety of vitamins in there that are not all good for you, especially if you're not exercising, okay? So Gatorade is not something that you should drink unless you're doing some sort of exercise and you're outside mowing the yard for 4 hours. And even then, that bottle is supposed to be diluted 1-to-1. It's not made just to kill that bottle and that's your fluid for the day. It actually is supposed to be mixed with water, right? So that you don't get that full burst of nutrition that it's giving you. But of course, yeah, if you're exercising, you're doing something, you can take that in. But there's nothing better than just water.
Okay. And another question I see here, it says, you know, we realize that we're going to have to be in these sports out there in the extreme heat. So is the only thing they can do is drink water? I mean, is that all that they can do to prevent, you know, getting dehydrated?
You can water down Gator. I mean, there's tricks, right? I mean, you know, a lot of people don't like the taste of water, especially, you know, older people, not so much kids. They make $1 million. If you go to Walmart now, man, the walls of artificial sweeteners and things like that, yeah, they're not the best. But if that's what takes for you to drink the amount of water that you need, and you want to make it taste like lemonade or taste like fruit punch or anything along those lines, you know, do it, right? It's just most people think fluid consumption. They say, oh, well, I drink tea. Well, unfortunately, tea is a diuretic. Coffee is a diuretic, which means that whatever you bring in, you actually urinate more than what you brought in, right? So there is nothing better than water because your body maintains all the electrolytes it pretty much needs, unless you're not eating any food, right? Which luckily all of us are eating food, and we're really just replenishing the water that we're losing through exercise or just daily loss.
Okay. Another question I see in the comments, people are asking, who is most at risk? What age is the most at risk to get dehydration?
I would say kids. The biggest issue is kids, especially in sports. You know, when my kid would play football, I mean, it's amazing. I mean, during the games, they were set up real nice, okay?
Right.
But our kids are going to school. They're staying at school. They're not coming home. They're playing with their friends. They're running around. And then they're going to play football. You're talking about 8-9 hours outside of your supervision of water consumption, right? So that is the biggest risk. I mean, you know, now naturally the biggest risks, because they're in a facility like that, is the biggest risk of serious consequences. I would probably say those of us that work outside, especially long days, long hours, mowing yard, those are the people that are at the biggest risk of having a severe reaction to the dehydration.
Right.
And, because one of the severe reactions to the dehydration is if you don't have enough water, you're going to start breaking down the muscle. And that can lead to even kidney failure because the cell of the breakdown is very difficult for the kidney to excrete it, right? To get rid of it. So the only way to help the body is with consumption of water, right? Whether it's through an IV or whether it's, you know, you drinking it.
Right.
And therefore that would be my biggest concern of individuals of saying, what are the biggest side effects and the worst case scenario medically But the biggest risk factor, of course, is our children. I mean, we just don't. We're not there to help them,
Right.
and that's why
another thing, Doc. I think the kids don't speak up as much as they should. They don't know when they need to, say something, and it might be too late.
Right. Kids are they're not gonna tell you they don't feel well, because then they won't be able to come home and play. Or
exactly. Right. They'll lie to you. Yeah.
Like,
I don't.
I'm not gonna tell you anything's wrong, because then I can't play outside.
Yeah, you were talking about IV fluids. I was really dehydrated once, and I came to Altus, and I didn't realize how much dehydration can pull you down, make you sick. Man, when I got those IV fluids, I felt like $1,000,000. It's crazy what fluids can do for you. I don't think people realize what a game changer getting fluids.
It is. I mean, we have a pregnant woman can come in. It doesn't have to be 9 months or 7 months. I mean, literally 3-4 months into pregnancy. And they got all these just little various complaints. Hey, this little headache, my legs hurt. I'm constipated. And you just give them some IV fluids, and before they leave, imagine that, they go to the restroom, they're comfortable, the headache is gone. I mean, so that's why it's everybody around us, right? Everybody's at risk. Okay, but if you're doing something like you're outside, or you're playing sports, or you're eating and drinking for two, your odds of being in this problem are obviously just higher, right? And we have to be proactive. Right. I mean, that's, my wife and I, for a little while, because we weren't that great at it, because we're all guilty of this, right? And some weeks you're better than others. But we would show each other, like, she'd send me pictures and saying, I beat my noon time, for the water consumption on her jug. And all these things are just games you can play as well with your kids, right? I mean, they all have phones nowadays, or your wife, yourself. I mean, just setting these daily goals and reaching them is always excellent, right? And this would be an incredible thing to kind of master, right? Because you won't even believe how you wake up differently in the morning when you're hydrated.
Right. I've been trying. Me and my wife have both been trying to drink more water. I mean, it's tough, because I'm not gonna lie. I love caffeine. I love Cokes, but I've been trying to cut back, drink water. It really is crazy what a difference it makes. Those are my goals. I'll try to start doing. I'll try to drink both of those. Okay. So I had another question somebody asked, and I'm not sure about this, but I know you'll know. It says, what is the difference between, or is it the same thing actually, hypovolemia and dehydration? Are those two symptoms both the same thing? Hypovolemia and dehydration.
Okay. So hypovolemia just means, low volume, right? Low volume in the body. And then dehydration is the specific cause, which would be, I'm not drinking enough water. So hypovolemia could also be, for instance, let's say you cut your leg and you're bleeding out. It's blood that's the problem, right? Mm-hmm. Versus the water consumption. Okay. So, you're saying a similar thing, but it's the cause of it, right? Can be different, right? Dehydration is related to fluids. Hypovolemia includes fluids in the possibility, but it could be, could be blood, right? It could be, it's a change in volume status, and not sure what the cause would be, right? So it's just status.
So here's a good one. How does dehydration affect the brain? Can dehydration affect the brain?
Absolutely. A prime example is an 80-year-old patient not drinking enough water, gets up at night to go to the bathroom, right? And while standing up, they faint, fall, and break their hip, okay? This story happens on a regular basis. I guarantee you, if you ask your friends or your family, that you have somebody either related or indirectly related to you that this happened. When you don't have enough volume, right, and you stand up, your body compensates by that, like that vessel, right? It has the ability to be 1 inch, right? Let's just give it a number. If you don't have enough volume, right, if it needs to compress to get the volume up to the brain. But if you're too low in volume and it can only squeeze so much, the body protects the two things that it needs, which is the brain and the heart. So what do? You faint, you pass out, and you lose all control of your body because it wants to protect your brain and your heart.
Yeah, that makes sense. Yeah.
So that's why it's very dangerous. I mean, dehydration leads to, that's what I'm saying. Like, I can't believe dehydration was the reason for my, grandmother's hip, fracture. Well, it was. I mean, she went to the bathroom, she sat down, and then when she stood up, she didn't have enough volume because she doesn't drink enough water, and unfortunately, broke a hip. Imagine that, right? The connection. And I think that's why, when we were thinking about topics and what to talk about, it's just so many variety of things that can happen that this is the actual root cause is something this simple, right?
Yeah, it's definitely an eye opener. Like I didn't realize until we talked today, and I don't think other people realize how much dehydration really plays a role in other factors of why they come into the ER. I mean, a lot of people wouldn't think that would be such a big factor and why they're here, but it is. It can play such a huge role. But since we're talking about the brain, another person asked, can dehydration cause high blood pressure? Can it make your high blood pressure go up?
Yeah, exactly. For the exact same reason that I said, right? So if there's not enough volume in the body, in order for it to reach the areas that it needs to, it will constrict the vessels, and therefore the blood pressure can go up. A lot of people will come in dehydrated, right? And essentially, I give them fluids and their blood pressure was like 220 over 110, which normally is 120 over 80. And just with simple fluids, it comes down. Why? Well, because now it's able to expand and go back. It's not having to stay constricted to compensate for not having enough volume in the body, okay? And that's one sign that a lot of people may not actually ever be able to see. I mean, it's not common for us 30-year-olds, 40-year-olds, 20, or definitely not 20 and below, to just even take their blood pressure, right?
Right.
I mean, blood pressure, of course, it's a completely its own talk. That we can go on for days with that one. But a lot of things are just silent, right? That you're not going to feel it. You're more likely to come in because you have a headache, cramping, or in pain, or you fainted than you are about the high blood pressure, because most of us are not used to taking our blood pressure.
So a person just asked, can dehydration change from kids to adults? The symptoms, right? I think we kind of touched about it earlier. Does symptoms change from adults to kids or kids to adults?
Or the time that you've been dehydrated, right? Like constipation is not something that you're dehydrated that day. The reason why constipation is very common is if you're not drinking enough, we either consume it, right? Through our food or through water, okay? So if you're not taking enough, that large intestine, right, is where we reabsorb water, right? So in order for because you're not bringing in enough water, it says speed up the bringing it back in from the large intestine. So when you do that, what's going to happen? Heart, constipated stools. And just because you go to the bathroom every day, no offense, people, it doesn't mean you're not constipated. I could do, you can be regular, go once a day, and I do an x-ray of your belly, and it's like, well, you are 100% full. And that's why you're nauseous, because if it's not going out one way, it needs to go out the other. And that's usually brought on from the water reabsorption, right? These hard stools. And you're just not flowing as much as you should. I mean, if you eat 3 burgers a day and only poop 2 of them, you're still up a burger every day.
Right. So another question I have for you, how can you, let's say somebody thinks they're dehydrated, and they want to come into the ER, how can you diagnose them and find out that they're dehydrated? What's the first thing that we can do for them?
That's why we normally get a urine. I mean, naturally, when you come into an emergency room, there's a couple of things that are kind of automatic, right? Like a urine for like women, right, in general, because maybe we need a pregnancy test, maybe we don't. But we have certain lab values, right? And the most important one would be your urine. And half the time you can even tell us, right? I mean, if you look at when you urinate and it's yellow or worse, right? That means that you're behind, right? Your urine should be as clear as possible. But in that urine exam, we have a couple things that tell us, your hydration status, okay? And it's called specific gravity, which the closest to water would be 1, and we measure like from 1.015 all the way up to 1.030. And it doesn't go beyond that, but that tells you your hydration status, on a lab, right? Now, if somebody comes in, we may do some blood tests, if we see that it's necessary, of course, because that would tell us, another version of it is to tell us how our kidney function, right? The way we measure kidney function is through a byproduct that as we walk, we always break down a little bit of muscle, right? And it releases something called creatinine. Mm-hmm. Some bodybuilders, anybody watching that workout, so creatine, right, is right. right? And we measure how fast the body can excrete it, and that gives us, the kind of kidney function status of the body, right? So that's another measurement. And then, in these labs, we can also check for muscle breakdown. So if the muscle breakdown is elevated, then we know that not only are you dehydrated, but you have serious concern for kidney failure and your muscle is breaking down because you're so dehydrated,
Right,
so
right.
ways, but it just kind of depends on the symptoms, right? You may not necessarily need blood, right? If you're just having a mild headache, for instance, and we have this urine that looks like that, that's why we like to offer, sometimes it's not necessarily, oh man, if you don't get an IV, you're not going to live. Of course not, but sometimes when you guys come in, it's always easier just to kind of put you back up to par, right? And I always offer patients that, even though you can go home and drink water, we can also put a liter in you, which is like drinking a gallon in the next 30, 40 minutes and feel better faster. And that's kind of one of the benefits of coming to the ER in general, where if you do have this issue, headaches or kind of get over it faster. It's very hard to drink a gallon of water if you have a headache and you're nauseous, right? So this
right. The benefits of IV fluids, you won't throw that up.
Exactly. So associated with, if the vampires are gonna go and get blood from you, we might as well keep the IV in and probably give you some fluids. It's usually
right. Well, so bringing it home, a lot of people are watching. They don't know when they should come into the ER. When do you consider it a dangerous point? When should people come to Altus and get checked out, to see if they're dehydrated or, other issues?
Some of the biggest things, headaches are never good. Okay. Now, people know their daily headache, right? I mean, if something is odd about the headache, you're definitely going to want to come in. Okay. If you see a kid or you see your husband or you see your wife, they've been out all day and you go out there and you're sweating and they're not sweating, that is a huge, huge, huge red flag, okay? That means that they don't even have enough water to produce sweat, okay? So if they're lightheaded and not feeling well, those are all reasons to come in and get checked out, okay? But if you see them where they are not feeling well and they're not sweating and they're outside, major red flag, okay? Also, in general, you get some belly pains associated with this. Just because dehydration is a common cause of constipation, it doesn't mean that it can't be a gallbladder or appendix. You got to be really careful, right? So, at the end of the day, if something alarms you where you say to yourself, I really don't feel well, and you know your own body better than anybody else, then you should always get checked out, always.
Right.
The lightheadedness, headaches, different than normal. And then, of course, that big sign of not sweating, if you see somebody outside, you're like, what's blistering hot? And he's dry and not feeling well. You want to rush him to the emergency room, him or her.
Yeah. And Doc, since we're talking about this, I know a lot of people watching stress or they're worried. They don't know if they should come to the ER. The good thing about Altus is we offer a free medical screening. I mean, there's no reason they shouldn't come in. I mean, their life, could be on the line. I mean, we have that free medical screening if you want to, tell them about that.
Yeah, so at Altus, listen, we're growing just like the community is growing, right? I don't want to say we're always fast and easy to get in because we have been, we are getting a significant rise in patients because our name is out there, and therefore we try to move patients as fast as possible. But that is your right as a person, not only at Altus, but we do pride ourselves on getting you in and out as quick as possible, but getting a medical screening exam. Hey, if you're worried about your blood pressure or you're worried about the headache or you're worried about the belly pain, you come in, you chat with us, and we're there for you. And, calling us doesn't help. I mean, sometimes you got to see a patient, right? I mean, it's very difficult to give medical advice over the phone because, most of the things that we need to do is actually physically see you, right? I mean, like I said, if you're not sweating, those are all good just signs that we're prepared to look at, and we're able to do things to kind of see, to make sure that you're doing okay, right? And then we can give you the best advice from that point. And if IV fluids is a recommendation, it's up to you to say if you want it or not, right? Or do I want to just go home and drink water? Or maybe something else completely different. You thought it was dehydration and we're like, we want to make sure it's not appendix.
Well, Doc, hey, thank you so much for joining us today with our first Doc Talk, guys. We're going to be doing this every week on Wednesday. And remember, like the doc said, we're here for the community. We're here for you guys. We have that free medical screening. We're here 24/7 for you guys. Thank you so much, Doc. I really appreciate it.
My pleasure, everybody, and take care and have a good week. Drink some water.
All right, that was a great topic, Doc. I'll talk to you next week. All right.
Let me send you that thing. Maybe we can, before you log off, if we can send like
For sure, yeah. I'll post it. Just send it to me and I'll post it for him. Thank you, sir. Guys, thank you so much for tuning into our first Doc Talk. Next week, Wednesday, we're going to have another great topic. We're going to be talking about the COVID variant. So much going on right now with that. So we're ready to talk to our community, let you guys know what's going on. But hey, thank you again. We'll see you next week, Wednesday, guys. Thank you so much.